we are going to discuss a very fascinating part of animal irritant topic, that is snakes and snake bite. Why this topic is important? Listen, as per the study, about 50,000 people are dying every year due to snake bite in India alone. So we must try to manage every case effectively at each level of healthcare. Like whether you are managing your patient at a primary healthcare center or at a tertiary care center, you must know how to manage the snake bite cases. So if we discuss about the Indian scenario, there are only 52 species which are poisonous out of 330. So starting with the classification, first one is venomous or poisonous snake, and second one is non-venomous or non-poisonous snake. So now we are going to differentiating them on the basis of their physical appearance. So let's talk about the venomous snake. As we know, the snakes are scaly animals. So the first we are going to talk about head scales of the snake. In the most of the venomous snake, the head scales are smaller. Take a look at this picture and appreciate the head scale of the snake. These are smaller, but there are some exceptions. So the first exception is cobra and the second exception is crate. If it is cobra, we look at the cobra head and we'll see over supralabial scale. The third supralabial scale is largest in the cobra and touching the edge of the eye. And in crate, we will looking at the infralabial scale, not supralabial scale. And on the infralabial scale, after leaving the medial scale, the fourth infralabial scale will be largest. After the head scale, now come to the belly scale. We are looking at the ventral body surface of the venomous snake. There are larger belly scales which will be covering entire width of the ventral body surface of a venomous snake. The next one is look at the tail of the venomous snake. The tail is compressed in venomous snake and it may be flat in case of sea snake. Come to the teeth of the snake. There are two fangs in the venomous snake. These are like modified canines. Okay. In cobra, the fangs will be short and fixed. And in viper, it is long and canalized. They are like intramuscular needles. The important feature is they are hinged. Means they are foldable. Now come to bite mark. In venomous snake, there will be fang marks like this, not bite marks. And if we talk about the habit of the venomous snake, they usually come in the night time. The poison apparatus is their salivary glands, and the saliva contain toxic peptides and enzymes. This is about the venomous snake. Okay. Now come to the non-poisonous snake. Head scale of the non-venomous snake. Usually head scales are larger and without any specific features. Come to the ventral belly scale. These are small or moderately large, but they never extend to entire width of the belly, like in poisonous snake. If we come to the tail of the non-venomous snake is rounded. There are no poison apparatus or their saliva is non-toxic. Let's come to the teeth. All teeth are uniform and small in size, and there are no fangs. Usually there are 4 longitudinal rows of teeth in upper jaw and 2 rows in lower jaw. If we talk about the bite mark of a non-poisonous snake, there will be no fang mark. There is a bite marks, there are multiple marks, and other is the habit is non-nocturnal. Here we are done with our classification of poisonous and non-poisonous snake. Now we can differentiate between them easily. To understand the nature of the toxins, we have to study about the families and the species of the venomous snakes in India. And we are mostly concerned about only 3 families. Number 1 is Elapidae, second is Viperidae, and third is Hydropinae or Hydropidae. The Elapidae family snakes are predominantly neurotoxic, and it contains common cobra, king cobra, and crate. Come to the Viperidae. The toxins of Viperidae family is predominantly hemotoxic, and it contains Russell's viper, pit viper, and saw-scaled viper. In Hydropidae, there is sea snakes and they are myotoxic. Well, all Indian species are present throughout the India, but we are concerned about only big fours. The big fours are common cobra, crate, Russell viper, and saw-scaled viper. We call them big four due to a reason. See, most of the snake bites in India are due to any one of these big four. The important thing to remember here is the Indian anti-snake venom is only effective against these four, like common cobra, crane, Russell's viper, and saw-scaled viper. Now let's discuss the important snakes one by one. The king cobra. It is also known as Ophiophagus ana because of its nature of eating other snakes. It can grow up to 2 to 4 meters and it is the largest venomous snake in the world. The head is flat and presented with a hood. Okay, the last thing is the fatal dose of venom of king cobra is 12 milligram. Now, this is common cobra, also known as Naja Naja. It can grow up to 1.5 to 2 meters. Okay, and if you compare the common cobra with king cobra, the common cobra have spectacle mark on their hood. This is crate, also known as Bangarus ceruleus, the one of the dangerous snake. It's a kind of silent killer. This is known as silent killer because the bite of this snake is painless. The fatal dose is around 6 milligram. It is exclusively nocturnal. This is Russell's viper. The length will be around 1.5 meter and its color is brown or buff color. Actually, it makes terrific hissing sound when it is about to bite. The head of this snake is flat and triangular with a distinct V mark and small scales. And the nostrils are very big. The body of this snake is stout with 3 rows of diamond shaped chains. The diamonds are interconnected and the belly is white and compressed. Now the last is saw-scaled viper. It is around 50 to 100 centimeter length and the head of this snake is triangular with white bird's footprint, arrow-like mark present on the head. The body has serrated scales like a saw on the back and a broad plate on the belly. This snake makes rustling sound while moving due to the rough scale.